and you're going to talk about Central Curry School District school-based health center that's proposed, right? And we got a lot of those. I just worked for Lincoln County for 6 years, and they have all kinds of stuff going on. Probably a lot of models. So, thank you very much.
Thank you for having us. My name is Lisa Hawthorne, and I will be coordinating the school-based health centers for here in Gold Beach as well as in Brookings. The Brookings Harbor School District has had a school-based health center in the past. It closed, and now the Oregon Health Authority actually was in touch with Coast Community Health Center to expand behavioral health, medical services into the school districts to make it easier to access for everybody. So Coast Community Health was kind of the only community partner who was able to meet the state standards for that. Coast Community Health is our primary clinic is in Bandon. We have another clinic in Port Orford, and we are expanding down into Brookings. So kind of up and down the coast, reaching those communities that have not received a lot of access to care. All right, so I'm going to start. This is Linda Maxon. She is our CEO, and I will let her talk about Coast in general, and then we'll talk a little bit about the school-based health centers themselves. All right.
Thank you very much. Dr. Rush, I laughed when you said no more electronic health records because I was standing outside the door there finishing up my meeting for all the things that aren't working with our electronic health record. If you want to join our team to help us, that would be great. So, it's not something I wish on any medical facility, but it is things that we've got to do, and we just went through a conversion after being on a system since 2014. So it seems like everyone's going through these changes. Thank you for having us. Coast Community Health Center has been operating in the Coos County area and then into North Curry County since 2010. We were formed as a small nonprofit rural health center. We were formed by about 60 community volunteers in 2008 and 2009. Many of them were retired Medicare patients who couldn't find a doctor to treat them because Medicare pays so little for a visit. And a doctor was leaving the area, Dr. McClave, and she was going to close her practice and go and work with doctors without orders. And the community said, you don't need to go to doctors without orders, why don't you just stay right here, because there's a lot of people right in our own community. Some of them business owners, some of them part-time employees that can't get access to care and they need you. And as a result, some of Dr. McClave's patients, Dr. McClave converted her practice into not-for-profit. And at the time I came, was moving into the area to live full-time in Bandon, and met up with this group who were making presentations in the community and building awareness. And I joined them in 2010, and we opened our doors on January 4th, 2010, with about $75,000 of funding from Oregon Community Foundation and from the Meyer Memorial Trust and the Ford County Foundation. And we started. And we started with 5 employees. We're now at about 60 employees. We're primary care and acute care, walk-in visits, and we've grown considerably. We changed our name from Bandon Community Health Center to Coast Community Health Center because our area that we served, there was a lot of people from Port Orford that had limited access to care. And the feedback that we got as we were growing was, well, your name is Bandon Community Health Center, and we can't come there. And we said, no, that's not true. And so we ended up changing our name to Coast Community Health Center. And in 2013, our board of directors made the decision that we were going to take the chance to write a grant application to be part of the Health and Human Services National Program of Community Health Centers in the United States. We wrote our application in 2013 to get our first site with the Health and Human Services, and we were the only award in Oregon that received an award for funding, which is reoccurring funding over and over every 3 years, to become a federally qualified health center. And the reason that we did that was because that federal funding gave us the opportunity to really ground our organization and have some reoccurring funding to to pay doctors and nurse practitioners and providers and help support our operations. So we are part of a network of 34 organizations. Some of them are public health departments, but a lot of them are not-for-profit organizations that operate around Oregon. In the United States, there are about 10,000 organizations, and some organizations may have 15 locations that provide care. Some may just have 2 or 3. Some may be Multnomah County, for example, or Clackamas County. They actually are a federally qualified health center and receive the same kind of funding that we receive, but they operate clinics all over the Clackamas County area. So federally qualified health centers started in 1964 as part of a demonstration project that, that a doctor believed that if you could bring medical services closest to those who need it, and you reduce those barriers, whether it be transportation or cost, if you reduce the barriers and you increase the access to care, the probability is that the people in that community could become healthier because they receive care easier. But the farther people have to travel, or the more barriers they have to get in to see a doctor, the probability is they're not going to go. And the probability is if they're poor, they may not go, and the chances are they're going to see a doctor, late stage diagnosis, because they just didn't have the money. And we think, well, who are those people? Well, those people might be your part-time bus drivers, school bus drivers who don't have benefits. They may be your local pastors. They may pack your groceries. They may run your coffee house. They're small business owners. Some of them may be people that live upriver and they can't get in. Some of them may be people that are working with small businesses but have those really high deductibles where you think about it. I had a small business in Bandon, and Coast Community Health Center paid for my insurance, but they didn't pay for my family's insurance. So I still put $800 out of pocket every month to pay for my family. And I came from a world where my husband and I were doubly insured in a corporate world. We had great insurance. Big company, leverage, a lot of power in the United States. But small business owners don't have good insurance. So they have to meet that $10,000 out of pocket before they ever get any kind of coverage. So that's who those people are. And if they're a small business owner and they're struggling to make it through the winter, that's those people that we are here to help. So we've operated in Bandon since 2010. In the middle of COVID, our board of directors made the decision to open up a facility in Port Orford. We opened up a very small facility with 2 medical exam rooms where the Uncle Bank donated the building to us. And we started in the middle of the COVID pandemic. And we built our new facility that we've opened up, a very large facility in Port Orford, where we now have, I think, 11 or 12 full-time employees that all have complete benefits. Doctors, nurse practitioners, licensed clinical social workers, licensed professional counselors, rotating drug and alcohol counselors, outreach workers, and we've created a lot of jobs. And we think, well, 11 jobs in Port Orford is 11 jobs, but 11 jobs in Port Orford with benefits and access to health care and the pharmacy and drug and alcohol counselors and licensed clinical social workers is a lot for that little community because they haven't had a pharmacy for 5 years. And Port Orford hasn't had a dentist for 17 years. So when you think about that, when you think about it in your community, 17 years, children went through 17 years or longer of their life where their parents never took them to a dentist locally. Never thought about, let's go down the street and get your teeth checked, right? So that's a whole generation, 20 years. Now as we're bringing dental services into Port Orford, that person is now 20 years old with children, maybe. But the way they grew up, dental care wasn't something they thought of all the time. But as we bring dentists into Port Orford, now we're going to help that young new parent think about going down the street with their child and getting their teeth checked as just a normal thing you do in your world. But if you, like I, have grown up in a place where we always had dental care, it's a pretty normal thing to just go get your teeth cleaned. People that lived isolated in Port Orford, and 12% of the population doesn't have access to transportation, they didn't think about dental care. So we have really bad teeth in Port Orford. So we're making changes. I'll go to the next slide, please. So a little bit about our history. That's our building in Banyan. We moved into that building in 2014. It was the old Veterans Medical Facility right across from the grocery store. We have it in that location because it's easy to access with transportation. There's services there, and our facilities are equipped with, as I said, all the medical professionals, but we also do other things. We also provide showers for those people who may need it. We also have laundry services for somebody who may want to come and wash their clothes and think, well, I don't know, medical facility do that. Well, there are people that don't have access to showers all the time. And if we can just make that little bit of a difference, and if that person needs medical care, I really want my provider to be safe. And if you think about would I want to derobe in front of a provider when I don't feel clean and I smell? Probably not, right? So there's a level of humility that when people come up to our counter and they are there for their appointment, they could be seeing our medical doctor, they could be seeing our psychiatric nurse practitioner or our providers or nurse practitioners, but they could be there for their appointment, and that happens to be a check-in where they have a 45-minute access to a shower. We have outreach staff and wraparound staff that work with our doctors and nurse practitioners that have access to our supply of underwear and socks and things that we can provide to a family or to an individual or to a veteran that may need it. That just makes a little bit of a difference. And those are called our wraparound services. Because we're federally funded, we have access for our patients to dental services where we can pay for those dental services. And sometimes that happens to be a Medicare patient that can't afford that Medicare secondary and they have no dental coverage, but they're not eating. They're only drinking soup. So if that medical doctor says, you look like you're losing weight, well, they're losing weight because they don't have good nutrition, and they don't have good nutrition because they have teeth that aren't well. So at our health center, we treat the mind, the body, the mouth. And when we look at our world over the last few years, we all probably need a little bit of help in all areas, right? It's kind of brought us down to a point in our world where we all walk through the door and we don't know what that help is that we need, but at our health center, we try to make it pretty holistic. Can we go to the next slide, please? Actually, if we could just go back one. So that's our building in Bandon. We've been there since 2014. This is our tiny building in Port Orford that we had donated. That was an Umpqua Bank. We had some wonderful grant funding that came through that we renovated the outside and the inside of that building and turned it from a bank into a small two-room medical clinic with the smallest pharmacy in Port Orford. I think it was 12 by 14. So that staff were not very happy working there for about a year, but we operated there until we could build this. And our board of directors purchased 3 pieces of property adjacent to the elementary school just off 101. And we have a 6-room, 8-room? 6-room exam, 6 exam rooms, counseling services, outreach staff, showers, laundry services. And this is our Port Orford Kitchener Health Center. We opened last year in the middle of COVID, after we had opened this one the year before to just respond to the community's need. And this building now, we're working on putting dental services into that community, working with a lot of different dental partners. Next slide, please. This is a hard one to see, but it basically tells a little bit of the story that in 2019, community health centers in the United States, the most important fact there is that we've served over 28 million patients. It's a very large network. Community health centers were started the same year as Medicare in 1964, and the program has grown and grown and grown. It's part of our federal budget, and every year community health centers continue to be part of that federal budget. Bipartisan support for individuals who need access to health care, both urban and rural. Next slide, please. These are some of our partnerships. You'll recognize some of the logos. As we are moving down the coast, our partnerships will continue to grow. We want to be able to serve the Gold Beach community, and we had the opportunity to meet Dr. and Mrs. Rush last year, and our partnership with them is just over the top incredible to have access to be able to put a healthcare facility in and use the facility that Dr. and Mrs. Rush have in Brookings. And our board of directors today just approved a notice of award that we did get for the $850,000 in congressional district to renovate that building. That's federal funds coming into a community that allows us to support just a very high level, this is what we've done for 2019 to 2021. We just finished our strategic plan at the end of 2021, and our board, at the board meeting this morning, is working on our strategic plan for 2022 all the way out to 2025. Your community and Curry County is very much part of that strategic plan in how we can serve your children, in how we can serve your district families, in how we can work with your community on whether we can find locations to provide services, whether it's a mobile vehicle in Gold Beach, and as we move down the coast as well. A little bit of history. As Lena said in 2021, our county lost our public health department, and that wasn't good. And it's a lot of transition for the community. And we want to be there to help. And we are the only federally qualified health center in the region and in this county. And because we get this very unique funding, we want to make sure that because Gold Beach zip code is in what we call our catchment area, we really need to focus on how do we serve the community. So part of the services we are providing has been public health services, and the Oregon Health Authority approached us to fill the gap of losing some of the public health services managed by the county, which we are doing and working with many other agencies. And then that brought us to the point, as Lena mentioned, where the Oregon Health Authority approached us to school-based health centers, because both of your school districts have been really underserved. I talk quiet, don't I? So we have accepted the opportunity to move forward in serving the school district, and in a very, very unique way, and Lena will talk about the staffing. But one of the things that we did in discussing this opportunity was that we knew that Brookings had a school-based health center and they lost it, or the agency that was providing it lost their certification. The only way that we could financially do this and make it feasible was to have two districts. Because we can't hire part-time providers. It's really hard. But each school district has to operate 20 hours a week. 20 hours and 20 hours is 40 hours. 40 hours means full-time. And so what we've done is made an incredible investment that isn't funded 100%. So we get $60,000, just $60,000 to operate a school-based health center in one school district. $60,000 doesn't even buy you direct compensation for a nurse. But if you get $60,000 and you get $60,000, now you got $120,000. But we know it's going to cost us about $214,000 to staff two programs. So part of it will be looking at additional funding on where we can bridge the gap. But it means that it allows us to hire full-time staff with the intent to say, you're going to work half-time here, and you're going to work half-time here, and we're going to create a program for both school districts. And I'm very, very grateful, and I'll step back after this, but I want to say I'm very, very grateful to both of your superintendents, because that was my one condition was, I can't do it if it's just one of you. I won't do it, because it's not going to work. But if we have two school districts that make a commitment, we can hire a registered nurse who's already done school services and is trusted by a school district, Lena, who's local. That's really cool. And Lena is our manager who will create and is creating these programs for the superintendents to bring school-based health center services into two districts. So this is not a short-term investment for us because we are not pulling staff from our health center. We've hired a provider, we're hiring a therapist, and we're hiring a medical assistant. And those three people, along with Lena, and one of our other providers that will rotate in, will allow us to serve some of your students in Brookings, part of the time to meet that 20 hours, and some of the students in Gold Beach to meet the 20 hours. And one of the really great things is we've been able to hire one male nurse practitioner and one female nurse practitioner. And I think that's really great for students. And I don't know how many school-based health centers have that, but fingers crossed, it all keeps moving forward, and we'll be able to have this as a mix where we'll have a female and a male nurse practitioner going into the school districts to work with students for girls. staff and the districts to create health and wellness for your students. So we're really excited.
Can I ask a question about post-community health first? Do you guys offer prenatal care for people in Port Orford and Bandon? And
That's a great question. It's a very limited because we know what we call our scope of practice, what we do, and we do it well. And then referral is to North End. Birthing services, labor and delivery, prenatal, postnatal, very difficult. We are working with one individual that has experience in that area that will be coming in for women's exams, but she will be able to do very limited scope prenatal and then moving on. And that's one area that's gonna makes me
really
sad.
lacking in our
It
county?
really
Yes.
makes me sad. So, and Lena actually has a background in that with the area hospital. So we actually are having a lot of families come to us because of that reason. The hope down the road as we continue to hire, we have one doctor that just started. Her dad is a doctor in Klamath Falls, and she just went through school and graduated. It's her second week on the job, and she just sat in our board meeting this morning. And she just finished her residency back in May, and she moved back and she's joined us. So pediatrics, definitely is potential. So I'm going to step back here. I'm taking your time. Thank you for inviting us, and we'll talk more about our health center specifically and the services.
Okay, so yes, thank you, Linda. The school-based health center in particular, it's a little bit of a unique service because it's almost like a doctor's office or a medical provider on site. So it really gets rid of those barriers to access for the kids. But not only do we serve the kids and students, we also serve staff members and families and even anyone in the community that might need to see a physician or behavioral health specialist. So they are integrated with into the school. We are working with the school district directly. They're on site. They are built on partnerships like Lisa talked about. One of the things is that we really want them to be youth-centered. So we want to create a space for the students and the youth to be able to make it their own. What do they need? They know more than us what they need and what they are looking for in their health and wellness and so it's going to be convenient for the parents and the students. It's accessible. We do bill insurance, but we won't turn any students or family members away if they don't have insurance or if they can't pay. School-based health centers across the board have proven to be effective in helping students to get a better education and have better outcomes educationally. But with that being said, they do require support from their communities to function successfully. So like Linda said, we are only receiving per school $60,000. Doesn't even cover our practitioners. And we really want to build a space that will be comfortable for our students and have them participate in that creation of a space. So we're coming to you all today to ask directly for money. We are looking for $3,000 to create these spaces for our students, for furniture, supplies, as well as an AED, which itself is $1,800 alone. So, does anyone have any questions?
I don't have a question, I just wanted to add, so what's unique for at least a short time right now at both schools is we didn't necessarily have the space for the exam rooms. So they have actually brought in their, what were they, the code response trailers?
Thank you, Eric, for bringing that up.
Yeah.
I forget that people don't have a picture of what we are.
Yeah.
So we have our mobile response trailers. So it's basically a clinic on wheels, and we have one at both schools. So we have two, and they're at the schools now. They're kind of hooked in, so they will be semi-permanent there. And then, yeah, so.
Yeah, so that's a unique thing we have, but what Lena has talked about is we also have the space that's basically their admin area, their triage area, the area that could be used for their mental health services. That is, we're able to use a classroom within our school at Gold Beach High School, but really to be able to provide what's needed for them to operate in the most efficient ways. That they needed some help with some things that we didn't have. We looked through some of our old furniture that we had, and then from desks to chairs to who knows what was in the room for them to kind of look through, and we were very limited for the things that we could provide for them, but other than just the space and the ability to have access there. So that's part of the reason why Lena is here. And I just wanted to give you a little bit of history of how we got really kind of part of this. David Marshall and myself, we were looking for mental health services for both of our school districts. I don't know if you are aware that our high school counselor passed away from an accident last year, and June was a very key point to helping our kids with mental health services. Well, with her gone, we were in a crunch. We were having a lot of issues. We had some problems of just kids coping with that, but with some other issues that we had as well. Kind of prior to that, David and I were working to try to get some telehealth within our districts. Well, they told us, you can't have these telehealth services that we are applying for through these grants because you don't have a school-based health center. Well, we're like, come on, really? We can't get telehealth, but you need us to have a school-based health center? And they said, yeah. Well, David and I tried to ask, where do we need to go? And we asked OHA, and then OHA connected us with Post Community, which has been a huge partnership for us. I mean, I couldn't give them a big enough pat on the back for everything that they've done for us. So I'm going to go back to that story I was telling about with our counselor. They actually gave us the time and the individual to come in and to work with our kids, and she's actually going to be working with us as our therapist now going forward. But they provided that service for us completely free. They said, you know what, we understand you're in a crunch, you need some help, your kids need some help, your staff needs some help. So they provided us an individual that worked with us, and it just made a huge difference within our school. I mean, I saw such change from where we were and what some of the kids were at. And we were at a really kind of a crucial time where we had a huge need, and they stepped up. And so when they said, well, we're going to do this partnership with you for a community-based health center, I was like, yes, please, 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 what can we do? What do we need to do? Let's get this going. And I tell you, from the school district side, we've had to do, to me, little, because of everything that they do and all the planning that they've done. So my hat's off to Linda, my hat's off to Lena for everything that they've done. And we're so excited. I try to keep my language a little more professional. I usually, we're around kids, we're so jacked, we're so happy, we're ready to go. But we're so excited about the opportunity to work with them and what they will bring for us. We've already got a list of kids that are ready to use the health center for behavioral health, but also for the medical side as well. Thanks, everyone.
Thank you.
I I assume that your patient's confidentiality, there's a wall between you and the school department.
Yep, absolutely.
What if a student comes in and seeks counseling and doesn't want his or her parents to be informed? What happens in those instances?
So in those instances, the age of consent is 14 and, well, 15 and up. It's a little bit gray, but at the consent of the provider, they can determine if they think that it's valid. But yeah, for the most part, if we are there to serve the students, and if they are needing mental health services and they are concerned about their parents not wanting them to seek those services, then we talk to them about that and explore the reasons behind that and go from there.
So this is always a really challenging point because we operate under HIPAA and the school district operates under FERPA. And we have to create that trust because it is true in the state of Oregon, the age of consent for general medical services is 14. But I will say that the providers that I hire, and anybody that has a license doesn't get hired unless I approve it. And the providers that we're bringing into the school district are very seasoned providers. Because I think that's really important. We're looking for very specific skill sets. And Dr. Kellogg, and myself, and Lena, we're all parents. So our goal is to help children be well. But we are also parents, and we recognize the need for parents to understand their child's wellness. Can we disclose information? No. I'm not going to dance around that. That is the law, and that makes and breaks a provider's license. But I will say the providers that we have, especially the ones that I would allow to go into a school, are going to be providers that understand the importance of children having a safe home environment and having good relationships and strong relationships and trust with their parents. So I think the way we practice medicine as an organization is a good, strong practice. But it's always a challenging situation. It's sometimes kind of difficult for parents to trust that. So our job is to go in and practice in providing school-based health centers for students, school-based health center services for students and for staff and for parents and for families. But we are a guest of the school district. So we will continue to work very closely with the school district. But it is even with school-based health center services, we operate under HIPAA, and there may be certain counseling services that happen with school counselor, and they will be operating under FERPA. So you see how it's complicated, isn't it? Yes?
So, kind of a question for Eric. Is there still a school nurse that plays into this equation a little bit?
So we ended up not continuing a contract with the school nurse. There was some issues that we came about with that. And so they will actually be able to use some of those services that our school nurse typically would have taken care of and really step in and help us in those areas.
Our public health nurse, Kelly Brown, some of you may even know Kelly and Joe Brown, has been a public health nurse, a vaccine nurse in Curry County Health Department and Curry Community Health, and then now Coast for many, many years working in pediatrics. So things like vaccines and services for pediatrics are things that we are all licensed and approved by the state of Oregon to provide. So kids' access to care is expanded because of that. So my hope is that as parents have concerns, as parents have questions, Lena is RN, and Lena is the program manager and will be the point of contact to respond to any parents' questions and concerns.
Another question. Do you guys anticipate doing, like district-wide, days or clinics for getting things like vision checks and, dental checks and stuff like that?
I sure hope so. I think every child should be checked for vision, and that's pretty near and dear to my heart, because that's where we catch things.
Yeah, and we plan on, if for any student that wants it, we can do full child checks there, and we will be doing vision screenings for those across the board.
Yeah, but I would say absolutely, Jeremy. That is definitely a goal that we have. We do vision screenings through other processes, but it would be something that we would do in partnership with Coast Community as well.
If we can partner with the Lions,
Yeah.
right before COVID, I had OHS School of Ophthalmology, and the KCI Institute that had reached out to me through some contacts that I have with them, and they have an amazing plan that they can bring down everything. We canceled all that, shut down in 2020. So opportunities for that. Our two coordinated care organizations, Advanced Health and All Care Health, are very supportive. We're in discussions with them right now to ensure that they will provide some kind of reimbursement for any encounter that happens for us, because that helps bridge the cost of this, which is really important. Van Messner is over the top excited about this because there is very limited access to pediatrics. So he knows that a lot of Medicaid members don't have access to care for children, and driving all the way to North End Medical Center is a long drive. The other thing is access to dental. So that's another area that I would really like to see us better understand. And then, there's the whole issue of in the high schools, is there ways that we can help with prevention for addiction? But we have to take one step at a time, right? And I want to really make sure that we do this and we really do it well. And we launch one thing, and we launch another thing. And I appreciate what Eric said when he called about behavioral health. I say no a lot because we're limited in what we can do. But sending one of our staff out there, Dr. Kellogg and myself, it was a yes. Because kids in trauma think with the front of their brain. And kids that are not experiencing trauma, that have good nutrition, that have an environment that they can come and learn and get grounded, they critically think of that their brain. And we know that a lot of kids come to school up here and they never get past that because they're tired, so they don't have food, they have situations going on in their home. And we really hope that really is our intent. We wouldn't be doing this for any other reason. It's what we do. It's part of our mission. It's part of our commitment to provide wellness in the communities we serve.
Just quick question. So the school-based health center is going to be at the high school. Will it serve people in elementary and middle school as well? And you mentioned in other communities, I think you have more of a full range for the population. This proposal is directed to the students, it's correct. But the idea that maybe at some point in the future, it could expand like we've done in North End and is that correct?
Yeah, so our top priority is the students, but at this point, we are not seeing anybody in the community. So it is on the school grounds, and the students kind of take priority. We will be seeing middle school, elementary school, and high school, all students and families and community members. Yeah, as it gets up and running and the word gets out, we expect we'll be seeing people from the entire community.
And we are a guest in the school, so we will let the school determine the policy and the procedure by which we can see individuals that are not students or district for safety reasons. And I'm sure you understand.
And that's one of the nice things about our physical location being on the school grounds but outside of the school.
So that was going to be my question too, is more for you, if it's gone, I'm assuming it's gone to the school board and then everybody's on board and
Yep.
we've already addressed all of that.
Absolutely. Yep. Yeah, it went before the school board. Actually, Linda and Dr. Kellogg came and did a presentation to our school board. And then we have an MOU between between Coast Community Health and the school district.
And our services to start this year, it's not optimal. Would I like to have an exam room and a proper facility with a proper reading room? Absolutely. But the school-based health center in Oregon, OHA had to make a decision. They either waited 12 more months till we had the time with Eric, or they gave us a waiver so that we could use one of our trailers that aren't being used, and we could start with something. And especially, we had staff that passed away in Gold Beach, and we had a child die in Brookings. And I said to the OHA, I said, "Do you want to wait?" And they get nothing, and we wait a year. Or we come in with maybe not the most optimal, beautiful setting, but we start somewhere, and we give them something. And I said, "I want to start here, so give us a waiver, so we can start." And that's what they did, and I'm very grateful, because they're good people.
One more question.
I just wanted to wrap back around because as a counselor, I've had, city counselor, not counselor, city counselor, I've had parents concerned about the idea of the age of consent. So it sounded like, and I just want to be able to say, it sounded like as a healthcare provider, you are encouraging the student's health, but in addition, a healthy relationship between the students and the parents to communicate about wellness. Does that sound?
That is encouraging. I know, of course, like Linda was saying, we are bound by HIPAA, so there is that we are always